In England, homes should be sanctuaries, a place where we feel safe, secure, and proud, a place that fosters health and well-being. But for millions, the reality is far from this. 8 million people across the country are living in homes that are cold, in need of repair, or filled with hazards. These unsafe conditions affect every aspect of life, from mental health to physical health, and for many, they can shorten life expectancy. Cold homes, damp environments, overcrowding, and dangerous living conditions are more than just a housing issue. They are public health emergencies. The consequences of poor quality housing can be deadly. This campaign includes leading health organizations, mental health advocates, aging groups, and more, people from across the spectrum, uniting with one goal: a safe, healthy home for everyone. But some communities face even more significant challenges than others. People from Black and minority ethnic households are more likely to live in unsafe homes. In fact, 38% of Black and minority ethnic households have at least one housing problem, compared to just 25% of white households. Pakistani, Bangladeshi, and Black households are much more likely to experience overcrowding. Research shows that Black households are 5.7 times more likely to live in overcrowded conditions, while Pakistani and Bangladeshi households face even worse outcomes. These conditions are not just uncomfortable, they are dangerous. Overcrowded homes increase the risk of accidents, the spread of infectious diseases, and the growth of damp and mold. In fact, 8.8% of Black-led households live with damp problems, compared to just 3.8% of white-led households. These are not isolated problems. This is a nationwide crisis that's affecting the most vulnerable, particularly in Black and minority ethnic communities, and it's only getting worse. 1 in 5 private renters report that their health has been negatively impacted by poor housing conditions. Cold homes are dangerous. Thousands die every year due to cold-related health issues, such as respiratory problems and hypothermia. Last winter, nearly 5,000 people died due to living in homes that weren't properly heated. Take Awab Ishaq, for example, a 2-year-old whose death was caused by black mold in his family's housing association home. His family had been raising concerns for years, but nothing was done to fix the problem. Awab's death is not an isolated tragedy. It's a reflection of a broader issue of neglect and systemic discrimination. The fact that Awab's family was from Sudan and faced challenges due to their immigration status played a part in how they were treated. People from Black and minority ethnic communities experience not only poorer living conditions, but also systemic racism in the housing system. They face discrimination when trying to rent, when reporting issues, and when they're simply trying to secure a decent home for their families. One study found that Black people are 5 times more likely than white people to report being asked to leave their homes by landlords. And when tenants complain about issues like damp, they're often told to clean it themselves, or worse, threatened with eviction. So, what can be done? First, we need a national strategy to address poor housing, especially for those most affected. This strategy needs to set ambitious targets for reducing non-decent homes, and it needs to provide resources, information, and support to households in need. We need to expand the Decent Homes Standard into a more inclusive Good Home Standard, applicable to all housing tenures. We need to make sure that people know where to turn when their homes are unsafe, and that they have the tools to make necessary repairs. The government must take urgent steps to adjust the local housing allowance in line with the rising cost of rents. They must recognize the right to adequate housing as a fundamental human right, and ensure that housing policies reflect this. We also need to tackle the economic disparities that continue to impact Black and minority ethnic communities. Black African and Bangladeshi households hold far less wealth than their white British counterparts, and this wealth disparity affects their ability to access decent housing. In London, Black Londoners typically spend a higher percentage of their income on rent than their white counterparts, and this financial strain makes it harder to maintain a healthy home. We cannot wait any longer. Black and minority ethnic people are 2.5 times more likely to live in relative poverty, and their chances of having access to safe housing are severely limited. We must act now to prevent more people from suffering. Join us in supporting the Safe Homes Now campaign. Demand that the government take action and ensure that everyone, regardless of their background, has access to a safe, decent home Visit Safe Homes now to learn more about our work, find out how you can help, and sign our petition for a safer, healthier future for all.